All right, continue with chapter 8. Now we actually go into the combining words, the suffixes, and the prefixes. Okay, so let's go amnio. I give you an example of amniocentesis, which is the surgical puncture to remove fluid from the amnion. Bartholome, so Bartholin gland, okay, named after anatomist. Cervical, cervix, neck. Okay, so how about an endocervicitis? That's just inflammation of the inner lining of the cervix. Choreo, chorion, so choriogenesis, formation of the chorion. Chorion, chorionic, pertaining to the chorion. And colp, you didn't know that, but colp means vagina, so colporrhaphy is a suture of the vagina. Okay. Cold, cul-de-sac. Coldocentesis is a surgical puncture of the cul-de-sac. Epes, vulva. You've heard of episiotomy, incision of the vulva and the perineum. Galact means milk. Galactorrhea, discharge of milk. Gyno, woman, female. Gynomastia, condition of female enlarged breasts in male. Hyster, you've heard of hysterectomy, which is removal of the uterus. Lacto, milk. Lactogenesis, formation of milk. Mammary, pertaining to the breast. Mammoplasty, surgical repair of the breast. Mastitis would be inflammation of the breast. Mastectomy would be removal of the breast. Menses, so amenorrhea, no menstrual flow. Dysmenorrhea would be pain during menstruation, and oligomenorrhea, a scantily menstrual flow. And metro is uterus, so metrorrhagia, excessive discharge of blood from the uterus between menstrual periods, that's called. Or you can have menometrorrhagia, which is excessive uterine bleeding at and between menstrual periods. Okay. Perimetrium would be membrane surrounding the uterus. So myo is muscle, that's myometrium. Myomo, muscle tumor. Nat is birth. Obstra is midwife, and O is egg. So myometrium, muscle layer. Neonatal, okay, so pertaining to new birth. Obstetric, pertaining to the midwife, delivery of the newborn. And oogenesis, production of eggs. Oophro is ovary, egg, ovary, ovary. So oophro and ovary mean the same thing. Ovule, egg, perineum. So how about a bilateral oophorectomy, removal of both ovaries. Ovum is an egg cell. Ovarian would be pertaining to ovary, ovarian cancer. And what about, well, ovulation, obviously, but how about anovulvatory, condition of no egg production? Ano or an ovulatory, right? Perineum. How about perineography? Suture of the perineum. To bear. Salpingo is fallopian tubes. Uterus, vagina, vulva. So uterine, okay, pertaining to the uterus. Vaginal orifice, opening of the vagina to the outside of the body. Vaginitis, inflammation of the vagina. And vulvovaginitis is inflammation of the vagina and vulva. Anarch or arche is beginning. Sciasis is pregnancy. Gravida is also pregnancy. And farce, so menarche would be beginning of the first menstrual cycle. How about pseudocyesis is a false pregnancy. Or prima gravida is woman who's in her first pregnancy, prima gravida. Primipara was woman who has delivered their first child. And paris is to bear, bring forth. Discharge means rhea. You know that. Leukorrhea would be a discharge of white vaginal secretions associated with cervicitis. Salpinx, uterine tube. Tosea, labor, birth. So phiosalpinx is pus in the fallopian tube. Tosea, oxytocea, rapid labor and delivery. All women like that, right? Version, active turning, so cephalic version, turning of the head of the fetus toward the surface. Dis is painful, endo within, in, intra within, and multi many. These are good review. Okay. So examples: dystocia, difficult, painful labor and delivery. Oxytocea would be rapid labor and delivery. How about intrauterine device, IUD, object that is placed within the uterus as a contraceptive device. Multipara, woman who has had many births. Multigravida, a woman who has had more than one pregnancy. Nulli is no, not, no. So nullipara is woman who has not had any vaginal births. Primipara would be woman who's had or is giving birth to their first child. Retro is backward. Which term removes removal of the breast? That would be mastectomy. Hysterectomy would be removal of the uterus. Mastitis is inflammation of the breast, and mammoplasty is repair, right? Surgical repair of the breast. Now some pathology of the uterus. You have cervical cancer, malignant cells within the cervix, cervicitis, inflammation of the cervix, endometrial cancer, malignant tumor of the uterine lining, endometriosis, endometrial tissue located outside the uterus. So unfortunately there's a lot of pathologies that can occur with the uterus. Fibroids are benign tumors of the uterus. So you can get a lot of fibroids. Ovaries, you can get ovarian cancer, malignant tumor of the ovary. Ovarian cysts, collection of fluid within a sac in the ovary. Fallopian tubes, pelvic inflammatory disease. You can get salpingitis, ophiritis, endometriitis. Leading causes of PID are sexually transmitted diseases. Breast cancer, fibrocystic disease. Arrows in a mammogram point to invasive carcinoma of the breast right here. Cut section of the invasive ductal carcinoma of the breast right there. What about during pregnancy? What can go wrong? You can get abruptio placenta, premature separation of the normally implanted placenta. Choriocarcinoma, malignant tumor of the placenta. Ectopic pregnancy, which is a misplaced implantation of the egg. That can be very dangerous to the mother. Placenta previa, preeclampsia. Some neonatal diseases that can happen: Down syndrome, hemolytic disease of the newborn, Highland membrane disease, hydrocephalus, Meconian aspiration syndrome, pyloric stenosis. Again, you don't have to know all these because it's not really an anatomy class, but I just want you to have some introduction to it. Again, the whole purpose of medical terminology is to quiz you mostly on the words such as here, the suffixes, prefixes, and the combining words. APGAR score is given scoring 1 to 5 minutes after birth. So if they have a heart rate that's absent, that's no good. If they get a 2, they're fine. Respiratory effect, if they no respiratory effect, 0. If it's good and crying, 2. Muscle tone is active motion, good. Response to catheter and nostril tested after aeropharynx is clear. Coughs or sneezes, we like that. 2, 2, 4, 6, 8. And color completely pink, so APGAR score of 10. Okay. We don't like blue or pale. So if they have a concerning APGAR score, then they're going to have to do something, right? I mean, there's lots of the procedure depending on which part is low. Some clinical tests and procedures. You can do the Pap test, which is a Pap smear. You can do a pregnancy test. Some procedures: hysterosalpingiography, mammography, breast ultrasound, breast MRI, pelvic ultrasonography. So break this down. What do you think a hysterosalpinography is? Salphon is fallopian tube, hyster is uterus, and whatever graphy you think is, right? So you can break this down. It sounds complicated, but it really isn't once you understand and just break it down. Conization, removal of a cone-shaped section of the cervix. Figure shows LEEP for cone biopsy. Laparoscopic oophorectomy. Ovary placed in a plastic bag. Here's a plastic bag. And extracted through a laparoscope. Amniocentesis. Needle placement guided by ultrasound images. And then here are all the crazy abbreviations that you're going to see in the medical charts. AB, AFP, BRCA1, BRCA2, BSE, CA125, C-section, SIN, CIS, CVS, 6, and you've heard of D and C before. Dilation and cauterization, couturage. AB is abortion, AFP is alpha fetal protein, high levels in amniotic fluid or fetus. BRCA1, BRCA2, breast cancer 1 and 2, genetic mutations. BSC, breast self-examination. CA125, protein marker elevated in ovarian cancer. C-section, CS is cesarean section. SIN, cervical intraepithelial neoplasia. CIS, carcinoma in situ. CVS, chronic villi sampling, cervix. And DNC, dilation and couturage. DCIS, DUB, FHR, FSH, GNRH, GYN, HCG, HDN, HPV, ART, HRT, HSG, and IUD. Woof. Wow. What's DCIS? That's ductal carcinoma in situ. DUB, dysfunctional uterine bleeding. FHR is the fetal heart rate. FSH is the follicle stimulating hormone. G is gravida, means that they're pregnant. GnRH, gonadotropin releasing hormone. GYN is gynecology, so you get an OB-GYN. HCH or HCG, human chorionic gonadotropin. HDN, hemolytic disease of the newborn. HPV, human papillomavirus. HRT, hormone replacement therapy. HSG, hysterosalpinography. And IUD is an intrauterine device or a contraceptive. Ooh, more abbreviations: IVF, LEAP, LH, LMP, multi-OB, PARAS 2012, PEP test, PID, and PMS. IVS is in vitro fertilization. LEEP, which I gave you an example, is a loop electrocautery excision procedure. LH is luteinizing hormone. LMP is their last menstrual period that they might use when you go to the OB. Multipara, multiparous, OB obstetrics. Para 2012, a woman's reproductive history, so that would mean 2 full-term infants, 0 preterm, 1 abortion, and 2 living children. So that's how they can document that. Pap test is a Papa-Nicolau smear test. PID, pelvic inflammatory disease, and PMS, premenstrual syndrome. PRIP, SLN biopsy, TAH, UAE, and VH. PRIMIP is primipara, primivirus. SLN biopsy is a sentinel lymph node biopsy. TH, BSO, total abdominal hysterectomy. UAE, uterine artery embolization. VH is vaginal hysterectomy. Again, you need to mostly, you don't need, again, it's not an anatomy and physiology class, so you don't need to know how any of this functions. I need you to know the spellings and the meanings of the words. That's the main thing. Spellings, meanings, and how to pronounce these words. Okay? So make sure you know all that. All right? Good luck.